Hi, I'm Dr. Glenn Phoenix, and I'm a chiropractic physician and a high school science teacher. I am currently teaching dual credit anatomy and physiology to mostly juniors and seniors who are interested in going into the healthcare field, and I also teach a little bit of biology. Currently, I'm enrolled in a functional diagnostic medicine program, and my goal today is to introduce you to functional diagnostic medicine. My passion obviously is education, and I want to educate the public into what exactly functional diagnostic medicine is all about and how functional medicine practitioners differ from traditional medicine practitioners. I hope to have additional series following this first one, explaining various disorders and how functional medicine practitioners would diagnose and go on and treat those various disorders. So what exactly is functional diagnostic medicine? It is science-based. It comes out of the well-researched publications. It is patient-centered, meaning that the patient is the focus of the attention. We're not treating symptoms, we're treating a patient. And it's systems-oriented. In other words, we look at the entire body and how the systems integrate with one another and how a breakdown in systems can result in the symptom pattern or disease process that you may be presenting with. And the approach is to help people achieve and maintain excellent health. This is accomplished primarily through natural methods using diet, herbal remedies, nutrition, exercise, and the like. And again, it seeks to address the causes of disease rather than just suppressing the symptoms. This is a nice image that helps demonstrate exactly where functional medicine practitioners place their emphasis. When we look at an iceberg, for instance, we see that just a small amount of it is exposed above the surface of the water. This would represent the actual diseases or the symptoms that a patient presents with. But the majority of the iceberg is below the surface of the water where you can't see. And these are the areas that are basically leading to or resulting in the expression of symptoms that the patient comes into the office with. So just treating the symptoms is just getting to the tip of the iceberg, so to speak. So for instance, diabetes, autoimmune diseases, arthritis. These are all expressions of some deeper underlying conditions that are going on. And the functional medicine practitioner will be doing a thorough investigation to find those much deeper underlying causes. So why is there a need for functional medicine practitioners? Traditional medicine, as awesome as it is in treating infectious diseases and trauma and acute conditions, it is exactly that, an acute care model. It is not very effective, nor is it really designed for treating or preventing chronic disease. If we look at this bar, we see on the left we see disease, and on the right we see health. And traditional medicine pretty much focuses on those two entities. A person either has health or they have disease. But there's a gray area in the middle, and this is where functional medicine practitioners focus. And the example at the bottom you can see is diabetes. A person could be in perfect health as far as their blood sugar is concerned, or they could have diabetes. But there's this area in the middle where a person is considered insulin resistant or pre-diabetic. Traditional medicine pretty much ignores these individuals. These people are not be really addressed until they get into a disease state or fully diabetic. Well, functional medicine practitioners will look at this gray area and will attempt to find the underlying cause of what's causing this insulin resistance and deal with it at this particular time, which is a much better time to address health conditions before they become a full-blown condition. So why doesn't the old model work? Chronic disease in the traditional Western world is food and lifestyle driven. It's driven by the environment that we're involved in, and it's also genetically influenced. The traditional medical model is not designed to address these issues. Chronic diseases aren't going to be conquered by drugs and surgery. In order to address chronic disease, we'll have to shift our focus from suppressing symptoms to addressing their underlying causes. Again, the iceberg analogy. The underlying causes are a much bigger factor than what is being expressed on the surface. So how does this new model work? Again, functional medicine integrates what we know about how the human body works with individualized, patient-centered. Every patient is different and doesn't respond the same way. So every patient is the full focus of the functional medicine practitioner's attention. Science-based care that addresses the root causes of complex chronic disease. These are rooted in lifestyle choices, environmental exposures, our diet, and genetic influences. Again, the bottom line, treat the roots, not the leaves. Let me give you an example of how a condition is treated both by traditional medicine and by functional medicine. We'll use irritable bowel syndrome as an example. Irritable bowel syndrome is characterized by abdominal pain and discomfort. Its cause is unknown, and the traditional treatment is symptomatic. On the left, we see the traditional Western medicine approach for treating irritable bowel syndrome would be to treat the symptoms using drugs like Zelnorm, which is now off the market, and Levsin. These two drugs basically have opposite effects. One causes you to go to the bathroom more, one less. Physicians may also recommend antidepressants to deal with the psychotic nature of irritable bowel syndrome. Over on the right, you're going to see the functional medicine approach for a person that presents with irritable bowel syndrome symptoms. Bottom line is we're going to try to get to the underlying cause of why the patient has irritable bowel syndrome by ruling out the following. First, many patients with irritable bowel syndrome have low acid output in their stomach. That's called hypochlorhydria. That's going to be looked at to see if the patient has low acid output. We'll look at the possibility of parasitic pathogens through ova and parasite tests in the stool. We'll also do comprehensive digestive stool analysis to look at enzymatic output from the pancreas and the small intestines, particularly looking at lactase, which is an enzyme that breaks down the sugar lactose in milk. This gives us a functional assessment of the whole GI system. We'll do complete blood chemistry, CBC analysis, and a thyroid panel. Lysosome testing to differentiate irritable bowel syndrome from inflammatory bowel disease. We'll do tests to determine the permeability of your intestines to see whether you have leaky gut syndrome. And we'll do gluten panels to rule out sensitivity to gluten. Treatment will be based on the functional diagnostic testing and is designed to treat the underlying cause, not just the symptoms. So the bottom line today is functional medicine helps clinicians identify and improve dysfunctions in the physiology and biochemistry of the human body as a primary method of improving patient health. Functional medicine seeks to improve the quality of life for people. So as you're considering what to do about your chronic illness or condition, give some consideration to finding a functional medicine practitioner in your area. You'll find that the functional medicine practitioner will spend a great deal of time with you, will have you fill out an extensive history form. You'll be amazed at the amount of information that will be gathered through the history taking and getting all of your past medical records. And your functional medicine practitioner will work with you to come to understand your whole story. And after understanding your story, we'll prescribe certain tests or order certain tests that will help to determine what the underlying causes of your condition may be. All right, so I hope this being maybe your first introduction to functional medicine will lead you to want to learn more. Stay tuned. I will be posting more videos on various conditions that are handled and treated through the principles of functional medicine. So thank you for your attention. I enjoyed doing this video for you, and I hope you enjoyed it.